Hi, welcome to Plant-Based Pregnancy and Parenting. This is a live Q&A. Tonight we're going to be discussing vitamins, supplements, and living toxic-free. This is sponsored by the Pregnancy Advantage, which is helping women to get their bodies pregnant ready or help if you are having trouble conceiving, especially before you go down that in vitro fertilization rabbit hole. And you can find our website at pregnancyadvantage.net. And let me introduce Dr. Deborah Shapiro, a plant-based OBGYN and certified in lifestyle medicine. You can connect with her on her website, anewviewoffood.com. And I am Jeanne Schumacher, co-founder of the Pregnancy Advantage. And you can find lots of resources to living plant-based and recipes and living toxic-free at simplyplantbased.net. Deborah,
hello.
We missed you last week. What happened?
Oh, yes. Well, like many people over the pandemic, I had a fractured tooth. I had a fracture in a tooth. And so I had to have an exploration to see how deep this fracture went, and then a temporary crown, blah, blah, blah. So very painful and unpleasant. And it made me think about you guys, actually, about the way what you're doing to be healthier during your pregnancy and to raise a healthier child. Because I was not raised on healthy food. And one of the foods that I was allowed to eat without much concern was sugar, which led to a lot of dental caries at a certain time in my life. And I really remember a certain age, I don't know whether I was 8 or I don't know when that was about that, went to the dentist, and I think there were a number of cavities that needed to be filled. And so I grew up with a lot of these silver fillings, and some were pretty big. And I remember the dentist always saying at some point, it's not, they're going to need to come out or change, or there'll be some weakness to the tooth. And sure enough, and, not like I eat anything that would break a tooth, but it can be broken on just anything. So anyway, what I'd like to say to people here is to take care and I know also people who are feeding their kids, and you probably see that too with the friends and your kids' friends, and that they're just being handed snacks and candies and they're not thinking about it. But it's interesting because not only will having healthier food and less sugar lead to less dental cavities and caries, but also if you feed children from a very young age healthy foods and less sugar and processed food, they'll have a better microbiome, and that will affect the growth of their mouth, their jaw, and their teeth. So when you think about if you went to Africa and you looked at people they didn't have dentists, but they didn't have crap to eat all day long. They have straight teeth. They have straight teeth. They do not have crowding, crazy teeth, needing braces. And this is because of a healthier microbiome, because they're eating healthier foods, plant-based foods, and not the foods that we are, and not the foods that we're exposing our children to. So all this to say, I applaud you all for being here and for paying attention to your diets and lifestyle while you're pregnant, and also as you raise your children, because it will have long-lasting effects their whole life.
Absolutely. And when you stop and think about it, you're right. I mean, in Africa, they don't have dentists, and they didn't have issues. And if you looked at some of the teeth of our ancestors, they didn't have the issues or the problems that we're dealing with. Mm-hmm. And one of the things that I'm teaching about at the school that I'm working at is we're talking about acids and bases and sugar, and the impact on your body, right? Alkalinity versus acidity, and sugar, extremely acidic, which is one of the reasons why it dissolves your teeth. But like it breaks down. That's what a cavity is like the acid is dissolving your teeth. So, yeah.
I grew up on so much crap. It's amazing. No one ever put the kibosh on anything. I was never told. Oh, I have to tell you, there was a funny thing. Someone sent around this meme. Actually, I think it was a gastroenterologist friend of mine. And it's a little TikTok, which are very addictive. So a TikTok of a little child, like a 1-year-old having its first birthday. And they're handing this little girl her first ice cream cone. So it's her first taste of ice cream. And it's amazing. If you could watch it, it's unbelievable, because she has a lick of this thing, and then her eyes are like, and she grabs it with both hands and she shoves it into her face. But that's dopamine. I mean, that is the hit. That's the reward. That's this, your brain just lights up, and it's so obvious. She's just licking this thing, and then it's like, it's very.
My grandchild, I have the same thing. My grandchild is being raised plant-based, and for the first time when they came over this summer, the child was just turned 1 and has never had any, ice cream. And it was obviously plant-based ice cream. And we would want out to have this. And this was his first taste. And his face, when she put that in his mouth for the first time, his face, his eyes lit up. And you're just like watching the pleasure trap right there. And when she gave him a taste, and she was just like dipping it in, like not giving him a lot, but just dipping it in. And, and then she would take a bite. And anytime she went to go take a bite, his face screwed up like he was about to cry, because he was like, and then he was like grabbing her hand to like pull it towards him. Like, no, you don't get it. I get it. And it was the most hilarious thing I've ever seen, to watch this in action. I saw it up close and personal this summer. It's true. It's true.
It would be amazing to grow up as a child and not have that, to try to get that, to reach that kind of pinnacle of explosive dopamine, but just to think that a baked apple with cinnamon and maybe a little maple syrup, or some date paste or date sugar, that would be sufficient.
Right.
Because I was chasing that all my young life. There was one summer, I think, when I was 15, where I just had a Snickers bar every afternoon at 3. A Snickers bar.
And you have the sugar high, and then you have the crash.
Right.
Absolutely.
And you want that, right? You always want that. It's like, I need something sweet, right? I just want something sweet. And I know a lot of this must resonate with a lot of people out there. I just want something sweet. Very hard. It would be wonderful to see another generation of kids grow up who are not so addicted to sugar. Because with sugar, it's the process, it's the high fat, it's the high salt. I mean, a Snickers bar has everything, right? Salt, sugar, and fat. Hits it all.
It hits it all, right? And it's not a great thing. And that's what I call it the potato hour in the afternoon, like about 3:00 in the afternoon, when you're just like circling around the vending machines and you're like, I got to have something, bring a potato. And so what I would do is, like, right after lunch, and when I was working and I was at work, after lunch, I would cut up a potato and put it in the mini Hot Logic and then heat it up, because I like hot. I like something, warm. Mm-hmm. And then I would put a little bit of like a sriracha sauce, which is a vegetable sriracha, on top of it. And, about 3:00, I would take that out and I would eat, maybe 1.5, those little small potatoes. I would eat some of those. That killed my cravings right there. It stopped it on the spot. So potato hour, it's real. Yeah. Bring a potato with you, eat that. That is going to stop your cravings and get you through the afternoon and give you clean energy, right? And so get away from stop circling the vending machines, okay?
Right.
All right. We've digressed.
You like hot things. I'm okay with cold. And so I'll sometimes take some hummus, also with hot sauce, and some mixed grains that I had made, and have that as a snack. And that's also really good. But, apples are perfect.
Yeah, too. They are amazing. Let's talk about, we left off the other night talking about vitamins. So I think we got up through vitamin C. We were going through the alphabet. So what do you got? What else?
Yeah, we were talking about nutrients of concern for pregnancy and just things that you need to be looking for in your vitamins. And, we can get a lot of these in our diets, certainly like vitamin C and stuff. We don't really have to worry, but some you have to put a little more attention to. Things like B12, we can't, because it's made by bacteria. Vitamin D also. So with C, another one we were talking about with C is, calcium and also choline. So calcium, you need 1,000 milligrams of calcium no matter where in your lifespan. Well, actually, when you're young, like a 12-year-old probably needs 1,200 or 1,300 milligrams. But if you're pre-pregnancy, pregnant, or lactating, it's 1,000 milligrams of calcium. And we can get it from where all the other big mammals get it. And that's after they finish weaning. And that is from greens, mostly from greens, leafy greens. But it is hard. I mean, you look at a rhinoceros who gets calcium from greens, but they're eating all day long, and we really don't. So you might want to supplement with a calcium fortified plant milk. Or if you like orange juice, you could have a calcium fortified orange juice, but it has a lot of sugar. But calcium fortified plant milks, I think, are great. And I use oat milk or soy milk, because then you're getting your bean at the same time. So look for those. Choline has recently been identified as a nutrient of concern for babies' brains. So And choline we get from egg yolks and from organ meats. So where vegans are not going to get that. So you could really look for, it's in everything a little bit. It's in beans and grains. It's in everything a little bit. But actually, the amount that we need for pregnancy is about 450 milligrams. So if you could get a supplement that has maybe about an extra 200 milligrams of choline, that would be great. D, I recommend at least 800 international units, but some people are low and you can go with that. Just keep your level above 30. I think it's micrograms per ml, but I take 2000, most of the time, 2000 international units a day. Also, vitamin D could also be in some fortified plant milks. E, I wouldn't take extra E. I would not take extra E. You get that from
there is some concerns about that. I mean,
yes.
Getting overdosing of that. So that is and that's one of the things about nutrients is you have to have this balance, and we only recommend like getting supplements and things like during pregnancy and topping it off before, so that when you do get pregnant, and then once you have your child, then get most of your nutrients from your diet, obviously with the exception of B12 and D. But when you are pregnant, we want to make sure that you get that your body is able to have all the nutrients needed to be able to create a healthy baby.
Right.
But there are some things if you are taking too much in excess. So that vitamin D is one of those.
Yes, all the fat, the fat soluble vitamins, A, E, D, and K, you could overdose, especially with vitamin A also. So just better to get the carotenoids from orange and red and yellow vegetables, or orange, yellow vegetables.
Right.
But we go back to this. So we have iodine, and iodine is definitely very important for the baby's neural system and can be severely handicapped if you don't get enough iodine before pregnancy, during pregnancy. So please, and make sure you're getting it also while you're breastfeeding. So 150 micrograms of iodine pre-pregnancy, it goes up to 220 and then 290 when you're breastfeeding. So when you're pregnant, 220, and you can get it at you can take 150 micrograms of iodine in your prenatal vitamins. Most people think that you should just get a prenatal vitamin that has the 150 micrograms of iodine. And then you can supplement. You can use a little bit of either a piece of nori seaweed or a kombu, or a sprinkle of kelp, but some of that can be very high. Wakame or arame. So there are these kinds of seaweeds that have, a reasonable amount, but are not too high. So be careful with that. And then there's also iodized salt, and about half to 3/4 of a teaspoon of iodized salt has 150 micrograms of iodine. And so if you're salt-free, you can't.
Yeah, I just want to jump in about iodine, because iodine especially is important for your thyroid. And if you were having issues with your thyroid, you definitely want to try and see if you can heal your thyroid. Previously, most doctors would say you can't heal your thyroid. I was told point blank to my face that you cannot. And that is not true. I mean, first of all, I healed my thyroid without question. Then there's a great book called Your Body in Balance, and it talks about healing your thyroid. And that is something you definitely want to get a handle on before you get pregnant, is to heal that if it's at all possible. And it may not be possible, but you'd be surprised once you're going plant-based, but you have to also get the toxins out of your life. So, and I just want to point out another thing about iodine, which gets displaced by fluorine. So if you are consuming fluoridated water, if you go back to, this is just, again, high school chemistry, simple single displacement chemical reaction, that if you look on the periodic table, fluorine is at the top, it's in the halogens. Anything below that, it's going to kick it out, okay? And iodine is below that. So if you are consuming fluoridated water, this is something that you need to be careful about, honestly. So you might want to do some research about it, but please, please, please. But going back to the toxins, and we're going to continue our discussion on vitamins and supplements. We're continuing that. This is an ongoing one, because we're going to switch topics and go to toxins. And Deborah, I wanted to talk a little bit about parabens tonight. That's another massive endocrine disruptor. And that is something that you're going to find in so many things. Honestly, I mean, like shampoos and creams, especially creams. And I'll never forget, I broke my wrist and I went for therapy, and the woman comes out and brings this tub onto the, of like a cream that she was going to use to massage my wrist. And I'm like, what's that? And she's like, oh no, it's a cream. I'm going to massage your wrist and it's going to stretch your muscles and everything, because I had surgery. And I said, just 1 second, please. And so I picked it up and looked on the back, and it had 3 parabens and 2 other massive endocrine disruptors in this cream. And I didn't say anything to her because I didn't want to be like that weird person, like this is my first time going there. And so I went into my Mary Poppins bag and I pulled out a cream and I said, please use this one. And she didn't say anything and I didn't say anything. And, she starts massaging it. And finally she said, why? Why can't I use that? And I said, well, it's mostly for you, not for me, because how many times a day do you do this? And she says, well, I might see 10 or 12 patients a day. And I said, okay, that's 10 or 12 times a day, because she wasn't using gloves. She was massaging directly on my skin. And that anything that you put on your skin in 26 seconds is in your bloodstream. So these parabens are accumulating. And your body thinks, but it's not, your body thinks and treats it like estrogen. So Deborah, is that going to cause a problem for a woman?
Absolutely. There are a bunch of endocrine disrupting chemicals that are very common in our environment. And parabens are certainly one because they're in so many personal care products. And you're, as the scientist, and as a chemist, these names. I think a lot of us aren't aware of all of the different names, these parabens, but we know some because we see it, right? Propylparaben. I see it on my, shampoos and stuff, right? Methylparaben, propylparaben.
Well, it doesn't matter which one, because it's a chemical family called parabens. Like you're right, there's methylparaben, propylparaben, butylparaben. It doesn't matter. They're all bad, okay? And so if you see the ending paraben, you do not want to throw it out. I mean, like seriously, get it out of your house immediately. And a lot of times they hide these chemicals and they use it in the term fragrance, okay? And they can hide these things. First of all, they don't have to list anything. There's no regulation at all, okay, on any of these personal care products. So it is huge. It's a huge issue. So for you ladies out there, one of the first things you can do is go to the ewg.org, download, they have an app called Healthy Living. And you can download it on your phone. And before you buy something at the store, you can take a screenshot of the barcode. And if it's in the database, it'll link it right to it. And what it does is it gives you a number on a scale of 1 to 10, 1 being the best, 10 being the worst. And you want to make sure you're looking, because it's really important for not only for you during pregnancy, because you're developing and creating another human being, but also after your child, you give birth, and you start using these products on your children, okay? From shampoos to, baby lotion or diaper cream or things like that. Oh my gosh, you've got to be careful, because I saw it in the classroom, 35 years, day in and day out, I saw the impact in the classrooms. And it's not just the food, it's the environmental toxins that we're being exposed to, so.
I think people will know, if I could just take 1 minute, I think people will remember that there was a drug that was also a xenoestrogen, a type of estrogen that women were given, called DES, diethylstilbestrol. They were given until 1971, when it was realized that it was causing cancers. But so this was a medication. It was that they were given to women, and it was causing not cancer in them, but it was causing cancer later on in the life of their child. So this is a whole other concept, this idea that these endocrine disrupting chemicals, these chemicals that act like estrogens in your body, and it's not just parabens, it's also things like BPA is a big one, another big one, and phthalates, which is an anti-testosterone, anti-androgen, that they cause. So what DES did is it caused a very rare kind of vaginal cancer in women called clear cell carcinoma. And that was if they were exposed in the first 13 weeks. But what we've also been finding is that there's an increased risk of breast cancer later in life in these women who were exposed to DES, their DES daughters, if they were exposed any time during their pregnancy. So you think about that, and that's just from DES. So that's stopped, and by now that the women who have been exposed from 1971 on are sort of aging out. But we still have a lot of these endocrine disrupting chemicals, like you said, they're included in the word fragrance. Yeah. So there are a couple of websites I want to tell you about also. So one is this company, right? Called
Pure Haven.
Pure Haven. Yeah. Everything is toxin free. So
they meet my standards. Okay. And if anybody's interested, message me. I'm happy to talk about them because it's all I use. And they have a great baby line and a kids line too. So again, toxic free, 100% meet my standards.
And then there are also two other websites you might want to check out, because they often talk about this Pure Haven, but one is Mamavation. She does a lot of exposure of different, she even talks about menstrual underwear. I mean, anything, and PFAS and things, and safe cookware and safe everything. That's fantastic. What was okay, what's better, what's best. It's terrific. And then the other is millionmarker.com. And she's also all about, this is a fantastic Jeanne, Jeanne, right? She's going to be interviewed for our next summit, but a fantastic doctor and scientist who's all about helping women to not pass these chemicals on through their breast milk and through their umbilical cord to their babies.
Right. No, for sure. And just to tack on to what you were saying, we have another summit coming up. And for anybody who wants to learn more about the summit that we had this past, I think June it was, that we launched the summit. We had oh my God, so many amazing speakers. I mean, like, seriously. And you can still purchase that summit. Plus, we have additional bonuses and recipes and things like that. So if anybody's interested, you can go on to the pregnancyadvantage.net. You can still purchase that summit. But we have another summit coming up that we're working on right now. And again, we're talking to some of these amazing people. And that was one, oh my God, she blew me away. Like, yeah.
But we had so much fun talking to these people, and I know they're all going to have amazing information that was going to help you on your way. There was just a recent study about the effects of gestational diabetes on mental health of their offspring for the next 40 years of their lives. And when you think about the explosion of obesity in this country and the explosion of diabetes and gestational diabetes, you can see where we're coming from. We're trying to heal you to make sure that you do not get sick during your pregnancy, because these illnesses have effects on the baby's developing neuroendocrine system.
It does. And there's a lot to learn, which is why we created the Pregnancy Advantage.
Yeah.
All right, Dr. Shapiro, thank you once again. Always a pleasure connecting with you. And we will see you guys. And if you have questions or topics you would like us to know, just put it into the group and tag us. We're happy to talk about it. All right, Deborah, I'll see you next week. We're going to be 8:00 Eastern, 5:00 Pacific. Join us.
Take care. Have a great week. Bye, everyone. Bye-bye.